Okay, so we are back with the lower extremity assessment of the musculoskeletal. So first I am going to have the patient walk a short distance so I can observe his gait and pay attention to the width of the base, the movement of his pelvis, and the flexion of his knees. So now you can go ahead and keep standing. There was no abnormalities there. So now I'm going to be inspecting the lower extremities for any bony prominences, swelling, deformities, contour. Same as we did for the upper extremities. So I will just take a look at his upper extremity or his lower extremities, and I'll take a look from the back. All right. Okay. So now we will go ahead with palpation. So you can we'll start by palpating the hips, and that is so we start with the iliac crest, and then we move to the superior and anterior iliac spine. And then we palpate the spine from the back below the dimples. Okay, did you feel any pain?
No.
Okay, you can go ahead and have a seat. If the patient felt pain, and then I would have palpated the great trochanter as well. And if the patient felt any pain while I was palpating those, I would lay him on his side and have him flex his hip upward like his knee to his chest and palpate for the trochanteric bursa. So now we will go ahead and start palpating the knee. So I will start by just palpating here above, and then we would palpate the medial and lateral the medial and lateral tibiofemorals, and then we would palpate the femoral condyles and the tibioplates and the collateral ligaments. No abnormalities felt there. Did you have any pain?
No.
Okay. So then we would then palpate the ankles. So you can go ahead and put your chair out. So with the ankles, we would be palpating the medial and lateral malleoli, as well as around the ankles. Did you feel any pain there?
No.
No? Okay. And then we would just kind of palpate the calcaneus and the forefoot, as well as the plantar fascia. So did you feel any pain there?
No.
Okay. So then now we will go ahead and start with range of motion. So you can flex outward as much as you can. And I will start with the range of motion of the hip. So I would place my hand underneath the patient's back and then lift his leg up and have him flex upward. Is there any pain?
No.
Okay. Then we would have the patient flex their knee and lift their leg up in the air for extension. And then abduction and adduction, we would just move in and out. And then we have the internal and the external rotation where we just kind of rotate in and out. Any pain there?
No.
Okay. So then we go ahead and start with, we move down to the knee. With the knee, we go ahead and just kind of hold the heel here, and we'll just kind of go up and down, flexion, and then I would have the patient squat for extension, and then we would stabilize and move this inward and outward, and then just in side to side. Any pain there?
No.
Okay. So, and we would be doing this bilaterally as well, but just for time's sake, I'm just doing it on the one side. So then we would move down to the ankle. With the ankle, we have the patient do the dorsiflex. So you're going to point your feet to downward, both of them, please. And then the plantar flexion, you'll point them upwards. Okay, and then just kind of move them in the circle there. Okay. Then with the toes, we would just kind of move all of the toes up and down. Any pain?
No.
Okay. So that's it for the range of motion. So then we would start the special tests. So the two special tests for effusion, the one, if it's mild effusion, it would be a bulge, and you would place your hand at the suprapatella and milk the effusion downward. If it was a severe effusion, it would be called a balloon, where you would place your hands on the suprapatella pouch, and then you would kind of apply pressure to the femoral, so that way you can see if you feel any fluid entering those spaces. Then we would test for meniscus injury in the knee. So what we would do with that is we would flex the knee upward. I would hold the heel, cup the knee, and then I would move inward and outward, and then flex back out. I did not feel or hear any clicks. Did you have any pain with that?
No.
Okay. So then that would, with no feeling or hearing of the noises or clicks, that would be a negative sign. So then we would move down to the knee ligament injury test, which would be where we lift the leg in an almost fully flexed position and then move it side to side kind of rotation. Any pain there?
No.
Okay, so that test is also negative. And then we would test for the ankle ligament injury, and with this we would have the patient move their feet up, down, and then around. And then I would also place one of my hands on the calf, one of my hands on the foot, and I will push down on the calf while pushing up on the foot. Do you feel any pain?
No.
Okay. So that test is also negative, and that's the end of our lower extremity test. Thank you.